Dorothy, a sweet, kind-hearted old lady who loved to rescue all types of stray animals. She once took in a little pony named Buzz. She didn't know much about him, but she knew he didn't seem well, and he definitely didn't appear happy. Even though Buzz didn't have any injuries, he seemed very underweight and didn't seem to be moving around much. Dorothy tried to offer Buzz different types of feed, but his behavior just seemed to get more confusing. Unfortunately, one morning when Dorothy went out to feed her animals, she found Buzz laying down. Then she started crying, realizing he had passed away. This is Buzz's skull. He was a domesticated pony, but as you can see, no one had ever done his teeth. Hi, my name is Josie Munder from Johnson County 4-H, and I've had a passion for equine dentistry since I was a young rider, beginning to learn about my own horse's health. From that time on, I started my training to become an equine dentist, and now I'm assisting my mentor, Bonnie Rhodes of Crossroads Equine Dentistry. My goal is to help my horses. My passion became helping others. I come to you today to share this passion and my knowledge. Today I will focus on 1, the anatomy of the horse's mouth, 2, the signs you'll see when it is time for an appointment, and 3, what you can expect when we come for your horse's next dental appointment. Every horse owner should know the basic anatomy of the horse's mouth. Our clients often ask how many teeth the horses have and what are they called. Well, it can depend. According to Dr. David Warren of Texas Equine Dentistry, mares will normally have 36 teeth and geldings will normally have 40. There are 4 different types of teeth in your horse's mouth: the incisors, the canine, the wolf, and the cheek teeth. These here in the front are the incisors. They're for grabbing grass and tearing forage. There are 6 on the top and 6 on the bottom. The next set are the canine teeth. These teeth are for fighting or defending themselves, and they are usually found in males. Next, we would have the wolf teeth. They would go exactly right here. But like these skulls, not all horses have these. Approximately 30% of horses will not develop these. But while they usually do not pose a health risk to the horse, they are often removed to prevent interference with the vet. Last but not least, we have the cheek teeth. There are 12 on the right and 12 on the left. They serve a purpose of grinding the forage, which improves digestion. According to my mentor, Bonnie Rhodes, horses chew in a figure 8 formation, grinding the forage, which improves digestion. Buzz could not do this motion, and this is why he passed away. Now let's talk about the signs you'll see when it is time for an appointment. One of the most common signs you'll see is hay falling from your horse's mouth. This is called quitting. This happens because the top and bottom cheek teeth are not making contact with each other. And then the horse will sense the food is too large for digestion and they will let it fall out. Another sign you'll see is any awkward chewing motions. This may look like chewing on one side of the mouth or slow chewing rhythm. For those of us who ride, here's some bad behaviors you can look out for. 1, are you having trouble placing the bit in your horse's mouth? Or 2, is your horse shaking or tossing their head? Or 3, are you seeing behavioral changes like biting, kicking, or even rearing? It is possible bad teeth can cause any of these behaviors. Now let's talk about what you can expect when we come for your horse's next dental appointment. There are 3 points I would like to cover regarding the dental appointment. Step 1, the exam of the mouth. I need to get in there and identify any issues such as sharp points or unbalanced areas that may make eating difficult or cause discomfort. I'm also looking for any inflammation or tears or sores in the cheeks. Step 2 is to knock down any sharp points that may make eating difficult or cause discomfort. This allows for contact between opposite teeth, promoting efficient chewing and reducing the risk of discomfort in the mouth. Step 3 is to fix any leftover malocclusions, which is just a fancy word for teeth not looking like they should. Now let's briefly talk about the tools. There are many different types of tools for floating teeth, but most commonly there's a float or a rasp. These both are designed to smooth out the rough points and correct imbalances in the mouth. While they accomplish the same task, they're as different as the types of equine dentists that use them. And yes, there are 2 different types of equine dentists, a natural equine dentist and a traditional equine equine dentist. According to Dr. Jewell of Texas Equine Dentistry, a natural dentist will normally not sedate the animal, and they will work while the animal moves around. And they will use a manual rasp. They believe this is more gentle and less invasive for the horse. My mentor and I are traditional dentists. We will sedate the horse before performing our work, and when we will use a speculum, which holds the horse's mouth open during the exam. Even though the horse has to be sedated, a calm, stationary horse allows for a more specific and precise job. Whether you choose a natural dentist or a traditional dentist, the goals of each should be the same, to achieve natural harmony and balance within the mouth. Today we've talked about 1, the anatomy of the horse's mouth, 2, the signs you'll see when it is time for an appointment, and 3, what you can expect when we come for your horse's next dental appointment. Maintaining your horse's dental health every single year is very important to their overall health and happiness. Now, are you ready to begin our appointments for your horse's next dental appointment? If you're interested about my topic, here are my references, and thank you. Any questions?